My pain is in the knees. I had pain in both knees, began about 10 years ago. Making the decision to do something was the fact that I couldn't walk more than about 100 feet without a significant limp and people noticing and commenting upon it. We decided on surgery, and the first decision was where we would have the surgery done, and decided that I'd have it done as an outpatient at their facility. I could go there in the morning, come home, recuperate at home. Worked with Dr. Dulik on numerous occasions, sharing numerous patients and seeing the results of his surgery and of the surgery that's done at Spectrum. Was able to talk to numerous of my patients afterwards. They would always come back with a positive response, how professional he was, how he explained things. And I found that I thought he was very personable plus professional, and decided that I was going to use Dr. Dulik as the orthopedic surgeon. But I wanted to be, if at all possible, able to be independent after a week, and indeed I was. I was able to walk independently, doing the therapy, knowing that that was making you better. It was kind of like being an athlete again, you know, rehabilitating a bad joint. And within a couple of weeks, you see how much different you've been, how less painful it is for you to walk on it afterwards, and the benefit.